I'm Jay Padong. I'm situated here in Texas. It's been a while. I've been here, and I was a practicing nurse back in the Philippines. I was an ICU nurse. That's my very first experience, and I was a clinical instructor after 2 years, I guess, from the clinical setting. Being an ICU nurse, and I was in the academy for like 6 years, and I went to Saudi for like 4 years, and then I became also an educator in a certain hospital there in Saudi, particularly in Riyadh. And I was an educator there. And I think the the education side is kind of pulling me, to really do education. And then I came here in the US. I actually went back to the Philippines and do the NCLEX and started singly on my own, this IPASS review, and then we had to transition in an online platform. I was already here in the US at that time, so here we go. And so we're gonna focus on the next generation NCLEX. Actually, this is already the new generation of NCLEX, and I would still call it like the next generation NCLEX because, you know, this is going to be a long, long way, you know the new generation is here because, again, the clinical. I mean, when you work here in the US, everything is really like complex. All right, and we would like to keep on it. That's why I'm telling you that this is already the future, and it's going to be a long, long way. So there's always going to be the next and next and next generation. All right, and it's going to be more and more and more complex. So there's no way that you cannot or you do not keep up with the practice of nursing here in the US. And it also applies in Canada and Australia as well, because, there's also people here that are going to take the examination, and practice the Canadian NCLEX, nursing practice, and as well as Australian nursing practice. So I would like to greet everyone, from the Middle East. I love you guys. I know there's a lot of nurses that are there struggling to take the NCLEX. Of course, it's gonna be a challenge because this is not going to be like the local boards. This is an international exam. In fact, this is the most challenging among us nurses. And considering we're adults, right? We're adults, and adult learning, right? We have lots of responsibilities, and most of us cannot really focus on our NCLEX journey. But to tell you, it's a matter of like organization. You need to organize. You need to structure your preparation. So you cannot really underestimate NCLEX. I would also like to greet people from, let's say, Europe. I know there's a lot of nurses there in Europe as well listening right now. If you are still contemplating, for example, like I was looking at the IPASS processing page, and then that was probably like 6th cycle or 7th cycle. And then here you go, you're already on 17th cycle. Please do not delay it. I know there's a lot of circumstances, there's a lot of factors that are involved there. For example, like monetary. That's why you can hardly take the NCLEX. But then again, please, if you are fortunate enough to have those, for example, like money, if I know there's always going to be an opportunity, okay? And if you're still thinking about it, and then I guess it's about time to really take your NCLEX. Do not mind about retrogression. All right, so I'm gonna take it like later because it's still retrogression. No, you have to be in the line. All right, because the moment that it will be lift up again, it's very random. Every month there's always going to be a visa bulletin. Okay, so the moment it's going to lift up, it's going to be current, and then you are already there in the line. Okay, so don't wait for anything. That's procrastination. It's the master of thief of everything. All right, so take that. Procrastination is always the master of thief. It's gonna steal your opportunities. It's gonna steal your dreams, in becoming a nurse here in the US, Australia, or Canada. I would also like to greet people from the Philippines, nurses, especially nurses in the Philippines, who are, of course, we know the fact that, we accept that we are a third world country. All right, we need to have some stability in our, finances. And it's always going to be a dream for us to come here in the US, Australia, or Canada to have a greener pasture. And we are actually we actually have an extraordinary opportunity. All right, we are not just everyone has an opportunity, but as nurses, as professional nurses, we have an extraordinary. It's an extraordinary. Okay, you cannot get it from like being let's say a teacher or an engineer or things like that, because we again the demand for nurses is always going to be there. Though the teachers nowadays in the US are very, very demanding, right, in terms of the workforce. But, as a nurse, it's always going to be super demanding because you're always understaffed. I'm telling you guys. So, in other words, you have an extraordinary opportunity, so grab it. Okay, but I know there's always going to be monetary, those factors that can like restrict you from taking the NCLEX. But if you already have some savings, if you have the motivations already, if you have these factors already, and I guess it's time to take your NCLEX. I would also like to greet our friends in Africa because we have some, nurses there coming from VSH. And yeah, so good afternoon, I guess, in Africa. So yeah, this is going to be really international. So our approach here is, as much as possible, in an international approach, okay? And yeah, but at the end of the day, we're trying to like reconcile everything. We're trying to align everything in such a way that we'll be able to understand, the next generation NCLEX, okay? Because at the end of the day, this is an exam. This is a universal exam that you cannot control, except that you have to learn it, from the start of what really NCLEX is, okay? And yeah, so let's start. I think my screen is not shared yet, so let me share my screen. I think our time is also limited, so yeah, might as well start. All right. Can you see my screen? I want to see the chat room. And guys, if you have any questions, I think we have an open forum in a day or two, I guess. So you can raise your questions or concerns during that time. So there's a scheduled one. I think it's gonna be posted in your in your portal. Let me see the Q&A. So how about greeting you guys from April there? So April is one of our students that is still preparing the exam. And then yeah, who knows? Like in 2 days, 3 days time, in 1 week or 1 month time, you'll be the one to, take your exam and then be able to be successful. All right. So okay, you can hear me, huh? And then you can see my screen now. Good evening. Good evening. Most likely Geraldine is from the Philippines. Okay. Oh, there's a lot of questions about roadmap. You know what? The question that I was looking at in the chat room is, sir, can we please put the table of contents? It's my intention not to put the table of contents. You know why? Because I don't want you to miss out anything. Okay? If you don't have the table of contents, the next thing you need to do is, scan it. Scan it until you, okay, this is maternal. It's not like, okay, cardio, I'm just going to look at cardio. You understand what I mean? Like you scan, and then you will find out that there's maternal here. I'm weak in maternal. So you cannot only focus on cardio, look at the maternal, and then you can, you can figure out, I need to focus on maternal as well. And some other, system. Okay? So that's why it's my intention really not to put the table of contents. There's table of contents in each pages though, but there's no, the page where it tells you the pages. But yeah, so that's my intention, to scan everything. It's not only your strengths, it's not only your weakness. Everything is vital, everything is essential in your NCLEX, each topic. So I think it answered your question that is it by system? Yes, it's by system. All right. I don't want you just to focus on your, on your weaknesses. You also need to improve your strengths. Okay. I guess you can see my screen now. So yeah, so feel free to ask any questions, especially in your in the scheduled open forum. All right, technicalities like how to use the platform and stuff like that. But yeah, you can see me also in some of the lectures, big lectures like cardio, like respi, neuro, and those stuff, and including your leadership and management. Okay. Good evening, LPDS. I know she's also one of the active ones in our live discussion. I would like also to greet to those who are new here, most importantly. All right, so you are in the right place. Okay, as long as you follow the structure, and I guess, the likelihood of passing the exam is really high, as long as you follow the structure. of our program. So welcome to IPASS Online Review and Mentoring Academy. We have some good people here, bunch of good people. All right. So we are building a community. All right, in helping you guys. All right. And yeah, so there's a lot of things along the way that I can tell you. Not only this orientation about the NCLEX, but at the same time, some words of wisdom to ponder upon. Okay. All right. So those things are very important in our journey. It's quite challenging, right? For sure, it's quite challenging. But at the end of the day, there's nothing really impossible if you have those, if you have those elements with you. Like for example, like your spirituality, and everything will follow. You'll be successful. Okay. So good evening, Kevin. Good evening. Oh, Kelvin. Sorry, Kelvin. All right, so this is the next generation NCLEX. Like I told you, the next generation NCLEX. Actually, the generation is already here. The modern kind of, super modern kind of nursing wherein there's a lot of complexities. All right? Complexities in a sense because you cannot just simply take care of a patient. I mean, on a single patient, there's a lot of comorbidities. Like way before in the 1990s, you will have like diabetes, no complications, just a single, single condition, the single underlying condition, diabetes. But it's complex, but not necessarily having a lot of comorbidities. But nowadays, you can see a lot of things on a single patient. Diabetes, actually, I mean, in fact, it's you associate it with the metabolic syndrome. So there's a diagnosis such thing as that metabolic syndrome, which is associated with hyperlipidemia, associated with hypertension, associated with diabetes. Your A1C is super high, your triglyceride is very high, and things like that. So it's very complex. So if it's complex, that means to say that we really have to keep up with our nursing. If you're going to bring back the 1990s nurse, I'm not a graduate of the 1990s, by the way. I'm a graduate of like 2000. I'm still millennial. Okay. Yeah, I'm still millennial because I was born in this particular year. But well, if you're gonna bring back, if you're gonna throw back, if you're gonna bring the 1990s nurse and then bring them to the current situation, the current nursing situation, I guess they're gonna have a hard time. Okay, they're gonna have a hard time. An ICU patient before in the 1990s are actually, you can see them in regular floors. That's how complex they are right now. So again, I'm telling you, you have to keep up with these complexities. The reason why your next generation NCLEX is established. All right. So yeah, so the next generation NCLEX, that's the very reason why, this NCLEX, next generation NCLEX is established, the NGN NCLEX. Okay. And again, there's a lot of information that I cannot begin. There's a lot of information that I can tell you. All right. Remember, it started in April 2023. 2023, that was about like almost 2 years ago. They might change it the next year because normally they change the manner of NCLEX every 3 years. Who knows? Who knows? They're gonna change it again in a more challenging one. All right. But the good thing about NG and NCLEX nowadays, the figures are very high. Okay. Our figures are way higher than comparing to the NCSBN figures. In the IPASS Online Review and Mentoring Academy, we are way higher than they are. The passing rate. Okay, but they might say, if I'm the NCSBN, oh, the figures are high, let's make it a little more higher in terms of standards. Okay, because we cannot just simply stay to the standards, right? So there's no way they're gonna raise the standards again. So it might happen in the next few months to come. In the next year, 2026, because it started 2023. So if you're thinking about still taking, tell your friends. If you are still contemplating of taking the NCLEX, might also take it now because the figures are high. All right, don't wait for them to change it. Okay, because again, there's no way they're really gonna change the standards. Okay, increasing the standards, it's gonna be more challenging. Okay, yeah. So it's an updated version of the National Council licensure examination for registered nurses, particularly again your NCLEX RN. So because NCSBN has some other entities as well, like advanced practice RNs in terms of exams. for certification exams. There's also like NCLEX LVN and things like that. So we are focused on the NCLEX RN, okay? NCLEX RN or registered nurses, okay? So it was developed by the National Council of State Boards of Nursing, or NCSBN. They are the ones who are taking care of all the boards of nursing in the entire US, okay? Including, the one in Australia, including the one in Canada. Because again, there's also a path wherein you can take NCLEX to practice nursing in Canada or in Australia through the NCSBN, okay? So yeah, so they take care of all these boards of nursing, including Canada and Australia. For example, I mean Texas Board of Nursing, all right? Illinois, for instance, in Michigan, for instance, okay? They implement the examination. They take care of the examination, all right? And yeah, so that's the National Council of State Boards of Nursing, or NCSBN. Okay, question. Sir, is it going to be different when I take Texas Board of Nursing? Though it's kind of technical, this question. But I'm telling you, sir, Texas Board of Nursing, is it different from Illinois Board of Nursing when I apply to them, or New York Board of Nursing? Is it going to be favorable on my end? No, there's no favor in there because everything is the same wherever you take your exam. Sir, is it okay to take it in Manila, in Pearson VUE? Of course, you need the Pearson VUE as the testing institution to administer the exam. All right. There's no difference between India, between, let's say, in Hong Kong, in Manila, or wherever, even here in the US. There's no difference to that. Regardless of what's the testing center and regardless of what's the Board of Nursing, it's all going to be the same. Okay? So don't think about, okay, I'm just going to take Texas Board of Nursing because it's easy or it's easier. No, there's no such thing as that. Just to at least, reconcile that kind of queries. Because I know there are some people who are still asking me that. Is it easier in Texas? Is it easier in Illinois? Or something like that. No. There's no difference. Okay? So like I said, the Next Generation NCLEX is to better assess clinical judgment. There you go. I'm always going to tell you clinical judgment because like I told you guys, we have to keep up with the complexity of the clinical situations that are happening in the clinical setting these days. That's why you have to have a prudent, decision making in exercising your nursing roles. Okay? So this is basically aligned in the real world nursing practice. So how do they align to the, to the real world nursing practice? By giving you case scenarios. So the secret there, there's a lot of secrets actually. So one of the most important aspect there, let's just say this is the cornerstone, the cornerstone of this is their foundation of the exam, okay, is giving you case studies. All right. So in such case, I think you will really have to dwell more time in answering case studies. All right, because that's again the cornerstone of the NCSBN. This NCLEX particularly. Are you still? Can you still hear me, guys? Am I still relevant here? I'm just getting your attention. I'm looking at your chat room, and I guess you're listening. Can I take my NCLEX exam in Laos? I know how you say your your name. Forgive me for that. Is there a testing center available there? I'm not really sure, in terms of, you can ask the processing, the IPASS processing if we have some in Laos. Okay? So clear. Okay. So let's move on. So to assess your clinical judgment. So any item in your exam, it's going to assess your clinical judgment. All right? And expect, these questions are really kind of challenging. I would say like these are most of them predominantly these are prioritization questions because that's the most convenient way. If I'm the question writer, that's the most convenient way to really assess the clinical judgment of a certain person, okay, or a certain candidate, okay, a nurse. All right, so it's gonna trigger your critical thinking. All right, it's gonna trigger your critical thinking before you decide the most effective nursing care. Okay? So yeah, so the manner of exam is adaptive question selection. That's why sometimes we call them a shortcuts. Okay? Computer adaptive exam. Literally, because it's computerized, of course, adaptive testing. In other words, it will adapt to your ability. If your ability is lower than the standards, then of course, they're going to fail you. If your ability, the other way around, vice versa, if your ability is higher than the standards, okay, and then I guess, of course, they're gonna, they're gonna pass you. You're going to be successful. So there's always going to be standards, of course. All right. But remember, guys, not to scare you. Okay. I mean, I'm not scaring you. Just to give a little like reassurance. Remember, you are going to be. I mean, this exam is an entry level exam. Okay, an entry level exam, an entry level. So you cannot expect the most, challenging questions, that advanced question, I would say. You're not gonna expect advanced questions. All right? Because advanced questions are designed for those who are taking, for example, like, if you finish your APRN practice, your master's, masteral, all right, you want to get the certification. So those are, those advanced questions are designed for them, not for you, because you are going to take the examination on an entry level. Of course, you're going to start from the entry level. So that gives you a little, reassurance on taking this examination. It's not going to be the most challenging at all. Okay? So yeah, they said there's a Pearson view in Laos. Okay? So yeah, so after each question, so just to give a little more discussion on this one, after each question, the computer evaluates the candidate's performance and selects the next question based on their ability. For example, you were given a question about pharmacology. Oh, you're able to answer pharmacology. Like, let's say, objective kind of question about pharmacology. Let's say, for example, it's asking about beta blocker. Okay, and then you were able to answer it. Okay, you were able to answer. I'm going to give you more questions about pharmacology, a more difficult one. So it's adaptive to your ability. Because you're good in pharmacology, let me give you a little more challenge about pharmacology. I'm going to give you something else. Let me give you a psychopharmacology kind of question. So it's going to give you, for example, SSRI questions, things like that. All right. So it's kind of like challenging you. And it depends upon your answer. If you got it correctly, most likely it's going to give you more challenging question. All right. If you, let's say, a series of questions, you're not able to answer it, I'm done with pharmacology, I guess, and then you did not answer it correctly, and then I'm going to give you another question, which is not pharmacology anymore, and I'm going to give you a little easier question. Okay, that's your, standards. But the thing is, the question is if it really fits with their standards. All right? So in other words, as much as possible, of course, in any exam, as much as possible, obviously, you really need to answer each question correctly, whatever kind of question it is. May it be case studies or whatever, you have to answer it. Most especially case studies, you have to answer it correctly. Because, when you answered it wrongly, of course, your ability is on the low side. All right? They're going to give you more questions, easier questions that they think that the computer thinks that you're on this level. All right. So if you're on that level, what I'm telling is you're on the lower level of that standards, and I guess you'll not be able to pass the exam. Okay. So yes, here we can read it. All right. The computer evaluates the candidate's performance and selects the next question based on their ability. If a question is answered correctly, the next question is typically more challenging. There you go. It's gonna challenge you, of course. If it is answered incorrectly on the other way, and the other way, the following question is easier. So we don't want to answer questions, easier questions, because most likely it's on the low side. All right. It's below the passing standards. All right. The more challenging it is, it's safe to say that's the more challenging it is, the higher chances or the higher likelihood of getting the exam, being successful. All right. Okay. So we have key features of NGN. All right. We have key features. Actually, this is the most important feature of NGN. All right. Like I told you earlier, case studies, guys. Okay. So all questions are based on clinical judgment measurement model, which was established by your NCSBN. All right. We call them as your NCSBN clinical judgment measurement model, or CJMM. Everything is based from there. Okay, from the word itself, clinical judgment, everything is going to be assessed in terms of which particular parameter in your nursing practice, in terms of how you recognize cues, all right, in terms of how you analyze cues, how you prioritize hypothesis. Basically, it's diagnosing your patient. You're not really a doctor, but you have to anticipate what's the potential diagnosis that that the doctor will hypothesize, all right, or will establish. Okay, and you need to know what what's the solution. So basically, this is nursing action. All right, how to take actions, or what are the nursing interventions that you need to enumerate, or what are the possible nursing actions for this particular problem, and you also need to evaluate outcomes. Okay, so your critical thinking skills in terms of how you recognize the cues, on how to analyze the cues, how to prioritize the hypothesis, how you generate solutions, how you take actions, and how you evaluate outcomes really play a significant role in taking your in answering questions. Okay, so this is basically nursing process. This is our bread and butter. This is what we do normally in each situations in the clinical setting. So, sir, clinical judgment. In other words, you expect all your questions. Majority of your questions are coming from, of course, from the clinical setting. All right, from the clinical setting. In the primary, I'm talking about the between the primary care setting or the tertiary care setting, which is basically in the acute care setting. All right. So in the primary care, for example, in the clinics, in the community, like nursing homes, things like that, you will rarely see questions related to those aspects or to those level of care in the primary care setting. All right. You will mostly see questions in a hospital setting, in an acute care setting. All right. Because this is where we use more of our critical thinking, your clinical judgment, in our practice. So medical surgical, things like that. Definitely most of our units here, most of our departments here are medical surgical. Okay, in other words, you will really expect that there's a lot of questions related to medical surgical. Okay, because I was telling you that most of the questions are coming from acute care settings, so you will expect hospital questions, and these are case studies that are really you can really see that these case studies in the clinical setting. All right. And the good thing about IPASS is that most of our lecturers, most of our educators, including me, all right, are working nurses here in the US. So we can really relate. So we know what we are telling you. We know what we are doing, guys. Okay. We know what we're doing on things that we normally see here. And it's very consistent with NCLEX as well. All right. Okay, so next new format of questions. Before, there's no close style kind of question wherein the candidates complete a sentence by choosing the correct answer from a drop down. So you can see a drop down, arrow. Click on it, and then you will see the possible answers. That's close style. All right. You also have the matrix. This is not seen before. All right, in the traditional NCLEX. So matrix or grid questions. You're gonna see a table wherein there's parameters. We just have to click on it, whichever is applicable. For example, the parameters are the signs and symptoms, chest pain, for example. And then it's going to ask you if this chest pain is applicable for, is this present in a patient having pulmonary embolism, or is this present in a patient having, acute coronary syndrome or things like that? Is this present in a patient having pneumonia? Is this present in a patient having, let's say, CHF? Things like that. All right, just have to click whatever is applicable. Of course, whatever is being asked. Okay, so you also have to read questions carefully. All right, and again, they're gonna show you the table with the parameters and with the diagnosis. You just have to click whatever is applicable, whatever is being asked. Okay, so that's matrix. Okay, so matrix from the word itself, yeah, that's the table itself. Okay, we also have the drag and drop. Okay, the drag and drop, these are, you need to prioritize actions or match the data to appropriate categories. For example, a bow tie kind of question. This is a classic example of drag and drop. A bow tie kind of question is also a case study question wherein, it's based on case study. And each boxes represents, of course, correct answers. And the possible answers are at the bottom. Okay, for example, the diagnosis here in the middle. Okay, you just need to drag and drop the possible or potential answers from here to there. I guess in the first few minutes of your exam, the actual exam, they're gonna give you instructions on how to do drag and drop. Okay, so I guess everyone is or know how to drag and drop. Okay, just I don't wanna elaborate on that one, but yeah, it's easier. So it's very user friendly. I don't think that I've encountered a student telling me that there's problem with their technicalities. All right. So anyway, there's if there's problem in technicalities in the actual exam, you can actually raise your hand and then call the attention of the proctor. Okay. So yeah, that's drag and drop. Yeah, you can normally see that in a bow tie question. Bow tie question, I'm gonna discuss to you about that. That's one of the case studies, type of case studies that can also come out in your exam. All right, because it looks like a bow tie, right? Literally, it looks like a bow tie, but it has a lot of questions involved there. I mean, there's one question basing from the case study, but it's more complex, right? It's more complex. It's asking you let's say the diagnosis and the parameters to monitor and the signs and symptoms that you need to assess from the patient. Uh, I was talking about the points, so it involves points as well. All right, so there's no way that you're not gonna get. I'm just gonna get the potential diagnosis and I'm good. You need to get everything there, right? Like I told you, do not waste anything. You need to answer questions, each question correctly, right? You cannot miss out. I'm just gonna I'm just going to answer the cardio part correctly rather than focusing on the maternal. No, everything is vital. Everything is essential in your NCLEX, each question. All right. Yeah, so that's drag and drop. So closed style, matrix, or grid questions, you have drag and drop. And yeah, those are the new things that you really see, new sets of questions in your NCLEX, all right? You can find it wherever, in the case studies or in some other questions, whatever it is. You cannot just simply see the multiple choice. Well, of course, there's always going to be multiple choice questions, but it's very variable. You can encounter many questions apart from the multiple choice, the traditional one. Okay, so the new question formats. Apart from that, we also have your highlighting hotspots. Highlighting hotspots is it's also user friendly, where you just have to click the particular, let's say the nurse's assessment or the nurse's notes. You just have, the question is asking about which particular part of the nurse's notes that are the most vital. Okay, highlight the particular portion of the nurse's notes. You just have to click on it, and then yeah, it will highlight the particular nurse's notes. For example, the patient is having chest pain. That's a priority. So you will highlight that based on the question, and then yeah, so you highlight that and it gives you a point. Okay, so bow tie question is basically drag and drop. All right, so you can mostly see drag and drop from a bow tie question. All right, so it's a combined central. There's a combined central issue, actions to take, like I said earlier. The parameters to monitor. Sometimes, I mean, most of the time, it's parameters to monitor, the potential outcome or the potential diagnosis, and then the signs and symptoms, whatever that is, being asked in your bow tie. But most of the time, the bow tie question is asking about the signs and symptoms, the most priority signs and symptoms, the potential diagnosis. It's usually 2 signs and symptoms. The potential diagnosis, now you're not going to do the differentials because you're not a doctor. You're not an advanced practice nurse. It's only 1. Okay. And then the other 2 would be, the parameters to monitor. So what are you going to do if the patient is having, let's say, potential diagnosis, acute coronary syndrome? So what are the diagnostic examinations that are priority? For example, EKG or troponins and stuff. Okay, so those are the things that you need to drag and drop with that particular box. Okay, so we also have your extended multiple response. So this is more than one correct option, allowing a partial credit. Okay, I would say like this is SATA. You select all that apply. More than one correct option, right? So it could be 1, it could be 2, it could be 3, it could be all. All right. And there's a partial credit on it. There's a partial credit. Unlike before, this is a good thing because unlike before, when you are wrong to that particular item, you were able to answer, let's say, which is not supposed to be an answer from the options. And then they're not going to give you a credit on that one, even if you got the other option, But yeah, it's automatic. It's automatic wrong. But nowadays, if you got certain, options there which are correct, they're gonna give you points. Okay, they're gonna give you points. Okay, so it's a good thing, right? It's a good thing. The academe before, they've been really asking the NCSB and to please give some credits to SATA because SATA is really dreaded before. But nowadays, I'm telling you, it's not really that dreaded. The reason why I enrolled in a review center before because of SATA, to be honest with you guys, because it's really dreaded before. All right, but there's no such thing as secret in SATA. Really, whatever kind of question it is, the secret is really your knowledge. All right, the secret is really knowledge. So whatever difficult question you're gonna encounter in your NCLEX is always going to be knowledge. That's that's the secret there in acing your NCLEX, not only your SATA. So don't be so scared about SATA or whatever difficult questions you are having hard time to answer. Please don't be scared about that. As much as possible, you love your SATA if you're, and the SATA will also love you. Okay. And the secret for that is, of course, to practice, practice, and practice questions. And then that's the time that you will say that, I think SATA is also loving me now, or things, or things like that. Okay. So, well, you cannot achieve that if you don't really practice yourself a lot. It's always going to be practice. The secret there, in order for you to master concepts, is to repeat, repeat, and repeat. You answer questions that are credible questions, and then I guess the likelihood of passing in your NCLEX is really high. All right, there's no way, if you compare a person who's not practicing the question, it's that you're just sleeping there, just laying down in your bed, watching, looking at the Facebook, whatever is trending in your Facebook, Instagram, or in TikTok, and then I think it's not gonna help. Okay, definitely, and you know that for sure. All right, I need to get up and then practice your questions. It's going to be just 3 months to 6 months. It's only going to be temporary. Okay, rather than just sitting there and then Facebooking or whatever. Okay, so it's not a good thing. You have to practice and practice and practice. You have to get up. Okay, you have to sacrifice things. All right, you have to sacrifice things, and I guess again, your likelihood to pass the exam is really high. It's a guarantee. Okay, it's a guarantee. Okay. Case studies. Let's talk about case studies, guys. Like I told you guys, that the best way to gauge your critical thinking and your clinical judgment is to basically your case studies. All right. This is the best way to also, again, your critical thinking. Critical thinking, by the way, is connecting the dots. All right. Connecting the dots. Critical thinking, for example, if you're taking care of a patient having, on a case study format, patient having chest pain. Oh, patient having chest pain. What am I gonna do then? What's your nursing priorities then? Oh, okay. I'm gonna assess what kind of chest pain is this. That's another dot that you need to connect. Okay. I need to get some, diagnostic examinations, laboratory workup. For example, your EKG. Because for the fact that EKG, according to evidence base, it's more, specific than the other diagnostic examination, like to the echo, for example. All right. So you have to prioritize that. So that's another knowledge, right? So connecting from each dot to another dot to another dot in order for you to conclude the best clinical judgment, the most standardized, and of course, the most, the safest and the most effective, interventions to your patient. All right, those are the dots that I'm talking about. And of course, if you don't have another big dot, okay, which is your pathophysiology, you will never know what is going on to your patient. So what is really going on if a patient having chest pain? And of course, you have to connect it to another dot, which is the history and physical profile of your patient. For example, the patient has an extensive heart history. So that tells you that this patient might be having acute coronary syndrome. That's another knowledge, guys. Okay? So so you have to align each dots in order for you to have the most, effective clinical judgment that you will be able to carry out to your patient. That is your critical thinking skills, amalgamated. I don't know what's that. That's the word, with your clinical judgment. Okay, with your clinical judgment. So critical thinking skills, and then your clinical judgment. Basically, clinical judgment is the whole thing before you carry out to your patient. All right, before you carry it out to your patient. All right. So so case studies. So candidates apply knowledge and clinical judgment across. By the way, I would like to emphasize on this one. The simple way to really tell you what's really your nursing practice is, of course, KSA, right? KSA, Kingdom of Saudi Arabia. I'm going to be biased because I worked in Kingdom of Saudi Arabia before, but no, it's not. In nursing, we call it knowledge, skills, and attitude, right? Knowledge, skills, and attitude. Nowadays, It's going to be knowledge, skills, your ability, or your attitude, and your clinical judgment. So KSA, knowledge, skills, attitude, and clinical judgment. Okay? Your clinical, should I say like ability, letter A, still A, clinical ability or clinical judgment. Okay, so that's very, very important, guys. It's not because, it's because of your license. No, it's not that. It's actually the patient's welfare, the patient's wellness, the patient's well-being. If you do it the right way, and I guess you are safe in terms of keeping your license. All right. Again, ultimately, it's really your patient. Of course, nobody wants lawsuits. All right. Of course, everyone wants this patient to really survive. Okay, that's why you really have to have a good critical thinking skills in order for you to come up with a good clinical judgment before you deliver that to your patient. That's gonna be safe, the safest nursing care that you can offer to your patient. You can carry out to your patient. Are we still understanding here? Okay, and I guess that's I just wanted to really instill this kind of culture not only in the context of NCLEX, but ultimately in the context of your practice here in the US. I don't want to see a nurse, if I'm the patient, I don't want to see a nurse who's not taking care of me well. Okay? Let's just say, I don't want to see a nurse that doesn't know what he or she is doing. I'm kind of a strict, patient for sure. Right? Again, you have to know what you are doing to your patient. That means that you have knowledge, you have your skills, and you also have your, of course, attitude and your clinical judgment. All right? You have to know what you're doing. I know it's going to be challenging in the US because there's always going to be, of course, prejudgment because you have a different color. It's not outright though. I mean, it's not spread out everywhere, but it can happen. Possibly, I didn't have any experience to that, but I can see sometimes that they are, they have the prejudice for sure. Because of the color, things like that. There's always going to be like that. This is the world that you're living in. You know what I mean? But again, you have to show them, okay? You have to show them that you know what you're doing. All right. And of course, you're not going to fake it because if you're faking it, they know. They know that you are faking what really you're doing. You're faking your knowledge or something like that. All right. If you're knowledgeable, you're really knowledgeable. If you have the skills, and it will really show. You know what I mean? So that's very, very important. Okay. So the candidates apply knowledge and clinical judgment across assessment, diagnosis, planning, implementation, and evaluation, and specifically based on the clinical judgment model established by the NCSBN. All right. So you're gonna be USRM 2025 for sure, Antoinette. Let's claim it. Okay. Just believe. All right. Believe in yourself. Believe in the process, and believe in God more importantly. Okay. And you're gonna claim that. All right. So types of case studies, unfolding case studies. Unfolding case studies has 6 questions. That's sequential. They're gonna give you a case scenario. You just have to click on the nurse's notes, the vital signs, whatever is the parameter in there. It's it's very easy to hover on it. Okay, click whatever is necessary, everything there, every parameter you need to click on it because that will give you a clue, that will give you of course, things that you need in answering questions. So there are 6 questions, sequential questions. And you know what? These 6 sequential questions are very specific to your NCSBN clinical judgment model. For example, question number 1, it's asking you about your critical thinking skills on recognizing cues, particularly on recognizing cues, down to your evaluation of outcomes. That's the 6th question. Unfolding because the case unfolds and unfolds starting from your assessment, starting from recognizing cues. But the bad thing about this one is that you cannot go back. For example, like number 3, you're already number 3. Okay, prioritizing hypothesis. You cannot go back to the recognizing cues, the first question, right? In other words, you answer the first question rightfully, of course, because again, you cannot go back to that. And you really have to have a good assessment skills in recognizing cues based on the parameters that is being given. So technically speaking, you have to read it really well. All right, you have to read it really well. Don't worry about the time because time is not your enemy in NCLEX. You understand? Time is not your enemy in your NCLEX. All right. In a multiple choice question, I'll give you like 2 to 3 minutes. NCSBN is telling us that the average time of answering questions, they said like around 2 minutes. But I would say like 2 to 3 minutes is fine. All right. It depends. That's a multiple choice question. It depends upon what kind of multiple choice questions that really needs analysis though. But in an average, they said like 2 minutes. All right, that's a good thing. All right, for me, that's not over analysis, either under analysis. You know what I mean? Just the right amount of analysis to the question. Okay, and you will never know if this is under analysis or over analysis until you will really exercise on answering questions. It will just what I'm telling is that it just really comes out naturally in yourself. Okay, it becomes a culture. Okay, this is the answer. This you know how to hover things. You know how to figure out everything. In answering each question. Okay, so the unfolding case study, like I said, are designed to mimic real-world clinical scenarios that progress over time. Like I said, it unfolds until you get the diagnosis, until even you evaluate your outcomes. So like a story, right? But again, you cannot go back to the previous question. In other words, you really have to answer it well from the beginning, okay? As the case unfolds, the candidate will encounter a series of questions that are very specific to the components of the NCSB and, like I said, judgment model. Another thing is the standalone bow tie case study. Standalone bow tie is a case study. Of course, it's just one case study. They're going to give you parameters, the nurse's notes, vital signs, the history and physical profile of your patient. You could even see like the order of the physician, laboratory finding, diagnostic workup, and things like that. And then you answer the bow tie. Like I told you earlier, it's going to ask you about the diagnosis in the middle. I want you to answer the diagnosis first, the potential diagnosis first before anything else. And the signs and symptoms that you need to monitor. And also the laboratory, let's just say the parameters to monitor. Okay, so let's say diagnostics and laboratory. Okay, so there's two of them. All right, you just have to drag and drop the possible answers which are found at the bottom of your right portion of your screen. Okay, in your answering your case studies, guys, please read the questions really well, and of course, analyze the case studies really well. It's gonna give you points for sure. This is again the cornerstone of your NCSB and Next Generation NCLEX. You're gonna get a lot of points from here. The other case study is that, oh, by the way, in your unfolding case studies, you can get as many as you want. Let's say unfolding case studies, let's say you get 5 questions, 5 case studies, with each one of them with 6 sequential questions, right? Okay, so that's a lot of points. All right, but to tell you guys, the NCSBN is telling us that the scored unfolding case studies, only 3 out of that 5 or out of that 6 or out of that 7. I think as far as I remember, that the most is 7 from one of the students. But again, the only operational, when you say like operational, the scored items, the scored case study for the unfolding case study particularly, are only 3. But the thing is, the sad thing there is that you will never know, you will not know what are the 3 among the 5 or 6 or 7 that are going to be graded, all right? So in other words, you have to answer them correctly. Okay, you have to answer them. You have to read your case studies religiously in order for you to get the answers correctly, right? So out of that 7, all right? But I like these case studies. I'm telling you, I like these case studies, not because I'm practicing nurse here or not because I'm an educator, but if I am on your side, it's gonna really like, I would say like trigger your thinking, as a nurse. Okay, so it's kind of not really challenging. It's for me, I found it really helpful, all right? And it's a good exam. It's a very, very good exam. That's really gonna assess you guys before you enter here in the US or Canada or Australia. Your standalone trend case study, all right? By the way, in your bow tie question, they did not tell what is, how many bow tie questions, all right? Only in the unfolding case studies. 3 scored unfolding case studies, certainly. But for this, no, they didn't say anything. For standalone, this is just a case study still, and then 1 question. That's it. Or let's say SATA question, again, coming from that case study, or multiple choice, or whatever it is, a grade question, or a matrix question, which has a lot of points on it, and then, but still, it's 1 question based on a case study. All right, so those are the 3 case studies you encounter. The unfolding one, which is the most, because it's gonna give you a minimum of 3, and you also have your bow tie. They're not gonna tell you if if it's 3 or 4 or whatever, but certainly you can get bow tie questions. Okay, but they did not tell us also that you can get as minimum as 1 or something like that. I think I'm not really sure if there are really nurses who took the examination that doesn't have any bow tie. And lastly, your standalone trend case studies. Okay, the standalone case study is again 1 case study and then 1 question only. All right, but who knows? Whatever kind of question it's given. Let me just give you a little. I mean, I'm running out of time though, but I think it was I started late, so I think I have an excuse to that one. But this is really important, right? So we're gonna at least compare traditional and next generation NCLEX. Okay, is Maya around already? I'm not sure. I can't see the the screen here. I can only see the chat room and the question and answer. Any question so far? Okay. You can throw your questions anywhere in question and answer, and then in the chat room, and then I can be able to answer it as much as I can, because it's also flooding some information here. All right. So comparing your traditional and your next generation NCLEX, the question format is primary multiple choice. Okay. For your traditional, and these days new complex formats like your your matrix and those stuff. Okay, it's more complex. Okay, clinical judgment focus is limited before, but now it's emphasized. And again, this is through case studies. Can you imagine like 3 minimum unfolding case studies? So that's a lot. That's 18 points. And how much more if we're getting like 5 or 6 or 7 unfolding case studies? So those are big points. So there's no way that you will not really, practice yourselves in answering case studies, all right? So traditional NCLEX, there are a few case studies before, but it's not really designed in such a way that it's going to really exercise your critical thinking, all right? There are a few of them. You can see that before, but it's very few, all right? But it's very, like, short case studies. Integral, everything is integrated in there. Like I said, unfolding case studies, 3 minimum, and the rest is standalone or bow tie, okay? Partial credit, there's no partial credit before, but nowadays there's partial credit. It's a good thing, right? In your SATA, at least there's partial credit, right? Before, as long as you are wrong, then you are wrong, whatever your choices may be. And then these days, at least there's partial credit, okay? And the real world relevance, which is which is very essential in, in delivering your tests, okay? So what's really the relevance of your NCLEX? I really love this one. Okay, I really love this new or next generation NCLEX. High relevance to the clinical setting. And you know what? To those who took the examination already, the NCLEX with the next, with the NGN setup, and then we're already here, and I guess they can really attest to that. Okay, that those we learned in NCLEX, answering those case study questions that, you see them a lot here in the US. So this kind of testing is really good, because it's really going to show you what's really happening in the clinical setting once you practice your nursing here in the US. Okay? Of course, I'm not lying for sure. I can really say 100% that whatever you see, acute coronary syndrome in your NCLEX, in your study, discussions, in your lectures, you see that here in the US. Okay? You see that here in the US. That's really going to help you in exercising your, in implementing your nursing roles here in the US, okay? So there's real-world relevance, of course. It's moderate, but I can tell you that these days, from that case studies alone, for sure, it's going to be high relevance to the real-world nursing, okay? The number of items, minimum 75 and maximum 150. That was before. Actually, it was like 250, 245 before, way before. And then it went down during COVID time, 75 to only 150. But nowadays, April 2023, started April 2023, it's minimum items of 85 and 150. That's the maximum. Number of hours, 5 hours, that's the maximum. The same thing, all right? The same thing. Okay, that's the maximum hours you can answer the whole thing. All right? Yeah, so that's comparing your traditional NCLEX and your next generation NCLEX. So why the NGN? Okay? Why the NGN? I told you already. So at least to validate some, to give you some information, why really they need to change the manner of examination, right? Research shows it's a very big, research. It's not only 1 or 2, samples. Okay, so they did a research for a long time, actually, for years. Okay, research shows that up to 65% of nursing errors are related to poor clinical judgment, especially or particularly among those entry-level nurses. That's a lot. 65% of nursing errors are coming from, from a poor clinical judgment. That's why as an entry-level nurse, we really have to improve that you really know what you're doing, guys, in terms of knowledge, skills, and your, clinical ability or clinical judgment, okay, as an entry-level nurse. Okay, you cannot just simply tell yourself that, it's an excuse because I'm entry-level. I'm a new nurse. No, it's not an excuse. Okay, so it's not going to change. It's not gonna give you an excuse for you to exercise a safe nursing care to your patient. All right. And again, at the end of the day, we have to take care of the well-being of your patient. Whatever you are, entry level, advanced nurse, or you are really an expert, you're a seasoned nurse, it doesn't really matter because they don't really care about that. All right. They only care about their well-being. Okay. So yeah, so I hope that that really translates to your that's gonna to your minds that whenever you practice here in the US, and I guess you really have to be super good. Okay, so do I still have time, Ma'am Days? Because I still have some of them here. Okay.
Yes, sir. Okay, go ahead, sir.
I can go ahead because I can see your face in the screen. Something like, oh, sir, it's already time, but I guess we're still good, huh? Okay, so NGN aims. The aim of the NGN is to ensure nursing candidates are prepared for high-stakes real-world scenarios, okay? To reduce the gap between education and practice, we have to be consistent with what is being in the books and what is being, practiced in the real world, in the clinical setting. There's always going to be gap between the knowledge and the practice, all right? So this exam, at least, their aim is to fill in those gaps for sure by making such thing as, next generation NCLEX. Okay. Improve the patient safety outcomes. This is what I'm talking about, guys, the well-being of your patient. It's not really your license. That's just secondary. As long as you do the safest care to your patient, okay, and I guess everything will follow. Your license is safe. Okay. So let's go with the scoring system. We have the 0-1 scoring. This is the traditional way. Okay. In this traditional scoring system, every correct answer is worth 1 point, while incorrect answer doesn't earn nothing. Okay. This method works well with multiple choices and other single response items. Okay. Your plus-minus scoring, this method uses a point system where correct answers earn points and incorrect answers result in point deductions. Okay, so plus-minus. So be very careful about this one because, this will apply probably in your matrix, I guess, most likely. The total score for a multiple item is calculated by adding up all the positives and negatives. Of course, I'm not going to explain to you the statistics, how they, come up with things like this, all right? So negative total scores are set to 0. Okay, so rational scoring. This method is ideal for analyzing items that rely on the understanding of linked information. I guess this is the fill in the blanks, the drop down, the closed style of questions. This will apply to that. So that's the rational scoring. And whatever that is, what kind of scoring they're going to implement on this. But generally speaking, they call it rational scoring. All right. So I don't know how much is the points on for sure. This is rational scoring. So this is higher kind of questions because you are answering the rational, highlighting and all those stuff. And I guess this should be a higher points compared to the others. Okay. So the passing standards. Okay, what are we imposing here? To meet the passing standards, high difficult questions, like I told you, must be answered correctly. Okay, must be answered correctly. So the more difficult it is, all right, the more difficult it is, the more chances of getting, passing. Okay, but sir, difficulty is subjective. Yeah, it's very subjective, right? It's very subjective. How do you know if it's difficult or not? Because it might be difficult for me, but it's easier for you. Okay, so it's very subjective, right? So the IPASS Online Review and Mentoring Academy strongly recommends that the candidates adhere to the structured study plan, including your coaching engagements, which is designed to foster a mastery of the subject matter and consequently improve their chances of success. There's no way There's no way that you cannot gain with coming from your perseverance in terms of really following the structure. There's no way that you will have a low likelihood of passing the exam. It's really going to increase your likelihood of passing or chances of passing as long as you follow it. And it's proven, all right? Additionally, I guess I discussed this one already. Difficulty, I mean, is subjective. It could be difficult for me, but it could be easier for someone. All right? So vice versa. So, yeah. But again, like I said, the safest way, sir, the next question would be, what's the most difficult questions then? Or technically speaking, what are the questions that gives you more, more points? Case studies. So you practice answering case studies. And when you practice, your case studies, guys, when you practice your case studies or any questions to that matter, please, okay, focus on the rationale. Okay, don't focus on your marks. Okay, don't focus on your scores. Focus on your rationale, right? Because the moment that you encounter the same questions in the next, in the next test or practice test, as long as you understand the rationale, I guess most likely you will answer the questions correctly in relation to that same, topics. Okay, rationale. Before, I was answering UWorld. I purchased UWorld before for like 3 months, I guess. I answered 75 items, like 2 hours. I would say maximum 2 hours, sometimes like 2.5 hours. Okay. That's in the morning. And in the afternoon, starting from 1 o'clock down to 5 or 6. I'm not going to stop. During the break only, like 15-minute break, all of them are rational. That's how I structure myself before. Using the UWorld. Okay. 75 items, like 2 hours. And then that's in the morning. And in the afternoon, the rest of the afternoon is rational. Okay? Because most likely, if you have 75 items, most likely you will have a lot of, concepts that are that were answered already. Like a lot of systems being thrown with that particular sets of questions. You can have cardio, you can have respiratory, and then again, rational for like the rest of the afternoon. That's how I study before. But it depends upon how you structure yourself, though. We have differences, but that really helped me on my end. Okay. So we have, I guess, let me just run down this one real quick, okay? We have the stopping rule. We have confidence interval, run out of time, okay? Run out of time. And we also have the maximum length. So let me just read this one, guys, okay? So respond to at least the 95% confidence level is the respondent or the candidate at least answered already 70 operational items. By the way, there are 85 items, right? Minimum 85 items, but actually 15 of them are unoperational. In other words, these are non-scored questions. Okay, non-scored questions. And the 15 items are the operations, which are the scored items. So the respondent already, answered the minimum items. Okay? 95 confidence interval. So the exam continues when the confidence interval straddles the passing standard. So whatever that is, if the computer is not 95% confident, okay, it's going to, let's say, continue. It's going to continue up to, let's say, 100 items. It's going to assess you again. Okay, but the minimum number of items they're going to assess you is 85 items. Okay, if it's not confident, it's going to continue again until it becomes, confident up to 95%. Either you are at the bottom, below the passing standard. The one in the middle is the passing standard. Okay? Or above the passing standard. If you're above the passing standard, you're good. They're going to pass you. Or if you're below, for sure, they're going to fail you. Okay? So this is the grid. This is the graph over here. So the vertical line is the difficulty question. And, the horizontal line is at the bottom. At the very bottom is the number of items. The one in the middle, the blue line, is your passing standard. Okay? So 95% confidence interval, pass with more than, this is the example of pass with more than minimum number of items answered. Okay? Responses above the passing line, blue, with 95% confidence interval. That's based from the 95% interval. Okay, the stopping rule number 2, maximum length. The maximum length is 150 items. Still, minus 15 items, which is the unscored items. Okay, so the candidates with abilities very close to the passing standard may receive maximum length of examination. Okay, whatever the time that you spend, okay? So that's about 135 operational items, right? Okay. And then it basically disregards the 95% confidence. Okay, that's the requirement, right? Based on the 95% confidence. But here, you're going to answer, the maximum blank, the 135 operational items, including the 15 unoperational. It's either going to pass you or fail you. So this is the maximum here. Here, the maximum. If you were able to answer everything, let's say, for example, in 3 hours, okay, and then you are here in the middle, the computer is going to evaluate, the last ability estimate. Okay, in this case, the last ability estimate is a little above the passing standard. It's going to pass you. Okay, before they said, like, I'm not really sure about this one though, but that was before they said that it's a make or break. Okay, that's the last ability estimate. But they didn't elaborate what are really, is it really the last question, or is it really the last few questions, or the last 10 items, or the last 15 items? In terms of ability, the last ability estimate. All right. If it's going to be, if the last ability estimate, regardless of the 95% confidence interval, okay, if they see it as, again, above the passing standard, they're going to pass you. You made it, okay? If it's below the passing standard, you didn't make it, unfortunately. Okay? So that's the maximum lengths. All right, let's move on to the stopping rule number 3. Run out of time. Okay, run out of time. In other words, the 5 hours has been passed. Okay? The candidate spends 5 hours already on the exam, but the exam has not been terminated by either the previous 2 stopping rules. Okay? Either the 95% confidence interval, and the other one would be the maximum length, right? So this one, the run out of time already is manifesting, or, it's already working in the system, okay? So what does it do? It's either this scenario. The patient responded to at least 70 operational items, and the final ability estimate is above or at the passing standard, they're going to pass you, even if you run out of time. Again, it's based on the last ability. All right, the last few questions, or the last question, whatever. They did not elaborate on it. Okay, so the other option, the other scenario would be like this: responded fewer than 70 operational items, which can happen. Like in 5 hours time, you already, it's very rare, I guess. You only answered about probably like 60 items. So that's that's too much. Okay, that's too much that's super less for a 5-hour period. Okay, for some reason. Or the final ability estimate is below the passing standard, of course, it's gonna fail you. All right, it's gonna fail you. So it's below the blue line. All right. Again, run out of time. Run out of time. Okay. So let me move on to your. I guess these are. See here, this is the final ability estimate below the passing line. This is again run out of time or root. Okay. If you look at this one here, it's below the passing standard, so it's failed. If the last ability is above the passing standard, it's gonna, you're gonna make it. But at least you answered 70 minimum of questions. All right, but you run out of time. Again, they will assess the final ability estimate, and who knows that is, or what that is. If it's just 1 question or 2 questions or 5 questions. All right. Okay, let me tell you this one. At least tips. So whenever I do my lectures, for sure, I'm gonna throw you some tips as well. Words of wisdom, for instance, okay? In order for us to really get your things done, okay? So tips for preparing your NGN: familiarize and understand the NCSBN in the first place. What is a clinical judgment model? And practice new question formats. Use resources like practice exams, like the one in IPASS. And if you want like UWorld, there's UWorld for sure. And for me, that's really the best because the rationals are really super good for me, because me myself, I experienced the UWorld. I purchased UWorld before, and it was really helping me. Okay, and simulation tools and case studies. By the way, we also have our own. All right, but it's always good to have some additional stuff. Okay, like UWorld. So I can only say that UWorld is really good because for me myself, I used UWorld and I passed. I passed UWorld. But there are some who are running out of budget for sure because it's monetary as well. That's a big factor in our journey. All right. So we also have our own, not necessarily with your UWorld. Okay. But if you have some extra, and then please, UWorld. All right. Simulation tools, practice exams, and of course, more importantly, case studies. But please don't forget other, items like multiple choice SATA questions, the traditional ones, because you still see it. But the big fraction of it in your exam is really case studies. Okay, and we have some drills in your case studies for sure. Like Paula, like Ryan is doing, and things like that. These are all, consisting in our program for sure. Okay, and I would love to go back to the drills again. It's not that because I'm tired already in lecturing, the topics of cardio or whatever. I would like to really, discuss like questions, because this is the best way to really exercise your critical thinking. All right. And focus on multi-layered critical thinking scenarios. Like I said, case studies. And focus on clinical scenarios. Prioritize learning real-world applications. The patient safety. NCLEX is all about safety, guys. All right. So you're always going to expect questions, not literally about safety and infection control, but anything to do with the safety of your patient. Not only related to safety and infection control, guidelines and stuff like that, but everything is about safety, even in your pharmacology. It's gonna ask you about pharmacology, especially of the safety and efficacy of that medication. Not only the efficacy of the medication, but also, more importantly, your, the safety of that medication. All right. If it's gonna cause like adverse drug reactions and stuff like that. All right. So you have to think about that. Pharmacology, again, it's associated with your patient safety. The pathophysiology, that's the foundation. If you don't know pathophysiology of your acute coronary syndrome, if you don't know what is happening in your acute coronary syndrome, developing clots, if you don't know what is a primary hemostasis and a secondary hemostasis, how it developed clots, if you don't know what's the function of these anticoagulants versus your antiplatelets, and I guess you're gonna have a problem. Okay, it's going to be a problem. Okay, so yeah, pathophysiology is really important. You don't need to memorize everything. You have to understand the concepts. Mnemonics are good. Okay. Mnemonics are good, but principles are more important. Okay. Facts are good, just like your mnemonics, but principles over your, facts. In other words, you need to understand what is there in your mnemonics. Okay. You understand what are those in your mnemonics. Please. You cannot just simply memorize because it doesn't work that way. Okay. That is not NCLEX. All right. And of course, use test-taking strategies. Read questions carefully, like the process of elimination, all those stuff. It's going to be discussed by Jamie. And in one of our discussions. Okay. Preparation is the key, guys. Preparation is the key. This is the feeling while you prepare your NCLEX. It's going to be hard, but it's going to be temporary because you will feel like this. Your face will be like this, when you pass your NCLEX. Okay. I would like to leave three words here. Okay, like inspiration. You have to know your motivation. Why did you take the NCLEX? Adversity. Along the way, you will encounter adversity, guys, for sure. During your preparation. Remember, this is an adult learning. You will encounter a lot of things, all right, during the process. Okay, and lastly, spirituality. Inspiration, adversity, and spirituality. And all the things that that are happening. Okay, the most important thing there is your spirituality. The element of spirituality can, put you in a long, way. All right, so you're gonna be successful. You just claim it, guys. There's always going to be an intended license number for you. You just have to claim it. Okay, you just have to claim it. You have to do whatever is necessary, and you're adult enough to understand what are the necessary things. All right. God bless you guys, and good luck in your exam, and see you in our lectures. Okay. So thank you, and I'll give the microphone to Daisy.